One of my followers asked if I would talk about the endometriosis-histamine link. There is a lot of talk about it right now, and it's super interesting, so let's dive in. There is actually a really fascinating overlap between histamine, mast cells, inflammation, and endometriosis. It's like your body went way overboard with inflammation and forgot where the off switch was. Endometriosis is when the lining of the uterus goes in places where it shouldn't. We now understand it a little better. We don't have it mastered, of course, but we're getting there. It's also an inflammatory, immune-active condition. Histamine is one of the inflammatory chemicals that can contribute to symptoms. Not the only one, but one that we can possibly target. What are mast cells? Ahoy, matey! They sound like cabins on a pirate ship, but actually, they are the cells that release histamine. They can be involved in allergic reactions, immune signaling, pain pathways, inflammation, ... Studies have found increased mast cells in endometriosis lesions and surrounding tissues. That means more local histamine release may be happening in areas already irritated and inflamed. See where we're going here? Histamine can increase pain sensitivity, stimulate inflammation, contribute to cramping, worsen GI symptoms, affect bladder symptoms, and potentially influence estrogen activity. So, some people with endometriosis notice cyclical allergy-like symptoms of flushing, headaches, itching, nausea, bloating, diarrhea, worsening symptoms with high histamine foods. See where we're going. The estrogen-histamine feedback loop. This is the part I find to be terribly rude. Estrogen may stimulate mast cells to release histamine. Histamine may also encourage more estrogen production. So in theory, more estrogen means more histamine. More histamine means more estrogen signaling, and the inflammatory carousel keeps spinning. This may help explain why some patients flare around ovulation and their premenstrual time with alcohol, during stress, after poor sleep, and with certain foods. Not everyone with endometriosis has histamine intolerance or mast cell activation syndrome, but there is growing interest in overlap among endometriosis, IBS, migraine, POTS, dysautonomia, Ehlers-Danlos syndrome, mast cell activation syndrome, chronic pelvic pain. There's a long list here.